Welcome back. Now we're going to talk about Medicaid and private health insurance under ACA. Before we kind of go into it, I just kind of wanted to talk a little bit about prevention and wellness and the reason why ACA put a lot of focus on that. So, chronic conditions, like I mentioned in previous models, are one of the leading causes of death and disability in the US. And many chronic conditions are preventable because a lot of them are, tied to like lifestyle activities and, with vaccination interventions and disease management programs, they are preventable. So the ACA recognized that preventing illnesses was more cost effective than waiting until they develop into the point that it requires management. Trying to get to that and trying to stop that before this diagnosis was one of the focus of ACA as a cost containment method. The ACA has a couple of prevention goals. First, one is to expand access to preventive services. One of the ways it achieved this was to require private health insurance plans to cover preventive services without cost sharing. This is why you can get vaccinations at no cost to you, or you can have wellness checks at no extra cost to you, at no cost, no cost sharing. Also part of it is that you had Medicare beneficiaries also receiving annual wellness visits as well. Another thing that the ACA did was investing in public health and community-based program. And one of the ways it did this was by creating the Prevention and Public Health fund that was specifically designed to invest in community health programs. This funding or this initiative funded anti-smoking initiative, obesity reduction programs, and a lot of funded a number of local public health efforts. Another thing that the ACA was able to achieve, or kind of had it as part of its intentions or its goal, was to encourage workplace wellness programs. And this it did by providing grants and incentives to employers that choose to implement worksite wellness programs. So for employers that signed up for that and were approved to that, were approved for that, it's allowed health insurance to offer in discounts for their employees that were participating in this approved wellness activities. Another thing the ACA also had was the key ACA prevention programs that were able to happen at no extra cost. Vaccination was one of them, but it wasn't the only thing. For adults, you had blood pressure screening, cholesterol checks, diabetes screening, cancer screening, as well as HIV or STI screenings that were provided to adults at no extra cost or no cost sharing, and then vaccinations as well. For children, and this was particularly covered on that chip, they had vision and hearing screening, they had immunization, they also had access to developmental and behavioral assessment at no extra cost. For emergency services after ACA was passed and enacted, it made it such that everyone could receive emergency services regardless of whether their provider or hospital was in network, and also prior authorization was no longer required in order to receive emergency services. Another thing the ACA put in place was the National Diabetes Prevention Program. This was established by the CDC to reduce type 2 diabetes, and this program is available in clinics, pharmacies, and community centers. through it, it provides lifestyle coaching for weight loss and behavioral changes. You can click on all of these links that I've provided in order to know more. I would particularly encourage you to click on this so that you understand much about this program. As population health managers, you will want to know more about this program, because you are probably going to be working with, chronic conditions, and diabetes is one of those that are quite popular. So understanding this program would be very, very helpful to you. So now that we're done with explaining the reason why there's a lot of focus on preventive care under the ACA, let's kind of look at the differences of what happened for Medicaid pre-ACA and what happened after the ACA was put into law. Kind of looking at it for a couple of categories: eligibility, coverage, pre-existing conditions, premiums, and all of that. So like previous tables, I've tried to make it as simple as possible so it's easier for you to kind of understand what happened pre-ACA and what that looked like post-ACA. So this is the continuation of the categories, market instability, and all of that. So with private health insurance, there's also this comparative analysis between pre-ACA and post-ACA. With the coverage, we have the 10 essential benefits. I've included a link to that, but in the third learning objectives, we are going to look more into these essential benefits and how that looked under the ACA. Did not exist pre-ACA, but in ACA, kind of have a closer look at what that is and how and what is covered and in what ways that is covered. And this is a continuation of table 7 that also compared, ACA, private health insurance before ACA and after ACA. So even though ACA was able to accomplish a lot of things, it does not mean that everything was hunky-dory with the ACA, and this is with Medicaid as well as private health insurance. So I'm going to start by discussing the challenges post-ACA for Medicaid, and then I'll talk about that for private health insurance. So some of the challenges that was experienced under ACA was that you had many non-expansion states, those states that chose not to expand Medicaid expansion, where you had in those states millions of low-income individuals being ineligible for coverage. If you would look back to Table 2, where I did a breakdown of eligibility for Medicaid, you will see that for non-expansion rates, it was very, very low. Some of the states were 30%, 27%. Compared to 138% of federal poverty level. And you also had some adults that were not at all covered in non-expansion states that were covered under expansion states. So you could see that there was quite a difference in coverage for non-expansion state versus expansion states, which then meant that there were millions of low-income individuals that could not receive coverage in non-expansion states. There was also challenges with reimbursement issues. With Medicaid's reimbursement rates is very low and the payments are also not high. Private health insurance have higher reimbursement rates than Medicaid, which then led to many providers not, participating in Medicaid services or Medicaid programs. And then they then had providers who refuse Medicaid patients. So they would only provide services to Medicare or to private health insurance, particularly in some states that had very low benefits for states that expanded or states that chose not to expand at all. So that challenge was, what ACA was not able to tackle that. And then because Medicaid was expanded, what happened was now there were more people who enrolled in Medicaid, and therefore there was a higher demand for services under the Medicaid. And this was a problem in the sense that some states did not have enough providers to take care of those of the higher demand. And so there were a couple of programs that the ACA tried to do to attract more providers, but they were mainly, demand was higher for the services versus providers that were willing to accept Medicaid. And this was particularly so for rural communities that had some challenges attracting providers. And also, and with rural communities, you're also dealing with many people who were low income. So that problem remained even under ACA. So then the challenges that were specific to private health insurance would be that when ACA came in, premiums and deductibles increased because remember, it wasn't just Medicaid expansion that Medicaid enacted in order to increase coverage. It also did the health exchange and also trying to get more employers to cover employees with ACA mandating that if you had 10 or more employees, you needed to provide health insurance to them, especially if they are full-time staff. So which then led to premiums increasing because in some states, with more people having to enroll, it then meant that they had to pay out more money to people, and they increased premiums in order to kind of adjust their risk level in terms of not having more people, more money they have to pay out compared to the money that they were able to get in through premiums. So, as you guys know, ACA focused on low-income individuals, as you know, trying to reduce the uninsured rates, which then meant that the middle class families who could afford health care, there was not as much attention that were paid to them, and therefore their cost sharing remained high even with ACA. Um, Private health insurance also had some challenges with experiencing financial loss due to high cost enrollees, in the sense that typically individuals that did not have health insurance were already either people who were sicker, and therefore their out-of-pocket payments was high because they needed to spend a lot of money because they were not covered pre-ACA. Now with ACA, they now had where they could cover, which then meant that a lot of people were buying up plans. But unfortunately, those people were people who were sicker, or they were older individuals. They were not quite they were not quite qualified for Medicare, but they were too rich for Medicaid, and therefore they were sort of in the middle, and their out-of-pocket payment was typically very high pre-ACA, and because they had a lot of need for healthcare services. But when Medicaid came into existence, they now had coverage. So a lot of them were buying up health insurance, and therefore leading to the insurance companies having to, receiving more claims than they were receiving pre-ACA. So, and this was because they did not have enough healthy people who were get enrolling. Because especially when the individual mandate was repealed, and because with individual mandate, everybody had to get health insurance, including low risk people. With the repeal of individual mandates, people who were low risk kind of had less reason to buy health insurance because their utilization of healthcare was typically low. So for them, it was cheaper, not not using health, not getting health care because they probably would go a year without needing health care services. So those who had higher utilization of healthcare needed health insurance, and therefore what then happened was that you had this with the scale tilting more to sicker and older individuals buying, less than healthier people. So, which then meant that insurance companies did not have as much money in their risk pool, and they were paying out more claims. So, which led to financial losses for some of the health insurance. ACA also introduced a bit of market instability, and this is related to policy changes, because while a lot of the provisions of ACA was, secure through the law, there were a number of implementation programs that were not directly mentioned in the law, and a lot of them happened as a result of administrative decisions. So when there's a change in administration, some administrations decide they're not going to continue with some programs that a previous administration had been willing to fund. An example would be with the Trump administration. When it came in 2016, it cut funding to cost sharing reduction subsidies. I don't know the status of that with the new administration, the 2025, but there are a lot of changes happening with the Trump administration. So it's not known, whether the cuts would happen again, or if there would be more cuts to some of the provisions under Medicaid. So then you had some health insurance companies that just stopped offering plans through the ACA exchanges. So there was nothing that mandated them to be in the health exchange program. So they could be there if they wanted to, and if they didn't have to. So some insurance companies just decided they did not want to be part of it. Of course, when you understand the fact that they were also dealing with the risks of having to pay out more claims than the premiums that they were getting in from new enrollees. So what this then meant was that there were then fewer insurance options for consumers that were hoping to get health insurance through the exchanges. And because there were fewer consumers, the insurance companies that remained kind of had to increase their had to increase their premiums because there was a few competition. So those who needed health insurance had very limited choices, and therefore they had to buy them, even though the premiums kind of increased, but that also caused market instability. So this is where we end with the second learning objectives. You can come back in a bit where we will focus on the last learning objective. We'll look at ACA and vulnerable populations. So see you in a bit.